If you're a woman in your 40s with type 1 diabetes and everything suddenly feels like it's getting harder when it comes to your health and fitness, you're not slipping. It's that the rules now just changed on you. So the body fat isn't going down anymore. The blood sugar swings get worse throughout perimenopause. And at the same time, your energy is dropping. And the same things that you've done in your 20s or even mid and late 30s are not working anymore. Today, I'll show you why that is and what still works, and how I've helped my clients in the last 7-8 years to lose more body fat, grow more muscle, and improve their body composition. And also, what's the most important lever to make that change and also make it a lasting change. Now, first of all, what's important to understand, and as you probably know, throughout perimenopause, estrogen goes up and down, so it kind of wildly fluctuates before it then declines in menopause. Now, estrogen isn't just a reproductive hormone, all right? It's also a metabolic manager, so to say. It helps manage your metabolism. The years before perimenopause, it helped keep your cells sensitive toward insulin, right? So that they are responding better to the insulin. Now, when it goes up and down, of course, the blood sugar fluctuations can feel super random and unpredictable, similar to which is not that random and unpredictable, but similar to your regular cycle, right? Where insulin sensitivity changes depending on the phase of the cycle, which then leads to you having a harder time managing blood sugar. And in perimenopause, when estrogen goes up and down, as you can imagine, that's what makes it so difficult. That's part of what makes it so difficult. Of course, there's an interplay of other hormones as well. Now, on top of that, there's also progesterone, right, which tends to decline throughout perimenopause and then also drops throughout menopause. Now, progesterone has this important effect on your nervous system, amongst others, and helps you fall asleep, helps you stay asleep, and have this calming effect, which is part of the reason why a lot of women experience anxiety symptoms or more cravings, because they now miss this calming effect that progesterone had before. And since it's not just estrogen influencing the insulin sensitivity, but also the ratio of progesterone and estrogen influencing it, that's what makes it so difficult and can make you feel like everything is so random and makes it super hard to control the blood sugar levels, okay? So to sum that up, when estrogen declines, since it's the primary thing happening, your cells get more resistant to insulin, okay? So you need more insulin to do the same job. That's the case for healthy people, but also women with type 1, obviously. We're talking about in a second also with type 1, what makes it even harder on top of all of that. But then also, the second thing when estrogen drops is that your fat storage shifts or tends to shift from thighs and hips to your belly. That's an important one. And you lose muscle faster, right? As I described in previous episodes and continue to do, muscle acts like this glucose sink, so it kind of pulls sugar out of your blood, even without insulin helping keeping blood sugar levels stable. So that's also another factor playing into that. And because of the progesterone dropping, your sleep gets disrupted. And when sleep gets disrupted, it's this vicious circle, because we know, also studies done on healthy people, just one night where you just have 4 hours of sleep can lead to a significant increase in insulin resistance for the next days. Okay, so it's this vicious circle where the hormones affect your behavior, like the cravings, like the sleep, and so on and so forth. And that behavior then affects hormones as well. So, right, it's a two-way street, and that makes it more difficult. Now, with type 1, there's a couple other factors playing into that. Of course, if your insulin resistance is affected, you need to inject more insulin, right? Whereas healthy people would just their pancreas would just secrete more insulin, you need to inject more. So the chances of you being off, if you need more insulin for the same thing, like you now need 15 units, it's of course a bit exaggerated, but you need 15 units for your pizza, instead of just 8, you will have a harder time. You will have a harder time getting it right, because if you're now 10% off, those 10% will lead to more intense low and more intense hypo, or a more intense blood sugar high. So everything is now more difficult, as you know. Now, that rising resistance means you need more insulin, and when you need more insulin, if we couple that with the fact that the insulin that we inject tends to lead to us storing more fat as opposed to the natural insulin, which is because the natural insulin our pancreas secretes goes to our liver and is distributed throughout the body from the liver, as opposed to the injected insulin from your pump or pen, depending on what you use, which can go directly to body fat cells, for example. Okay, so that's one of the things that make it harder for us generally as type 1s to lose body fat. But that then, of course, is another factor that comes on top of the insulin resistance loop that happens throughout perimenopause. Okay. Now, if you stack that on top of long hours and you having children, because likely in your 20s you didn't have children, and now in your late 30s and 40s you have children, and very likely you also are more experienced professionally in whatever you're doing, so you have a higher stakes job, you have more responsibility and a higher income, which all right increases responsibility next to just the family that you have, just quote unquote just the family. That all leads to more stress. So it's it's a decreasing stress management essentially, like the decrease in how well your body can handle stress, but an increase in stress, of course, right? So it's a difficult situation, and that's enough of an explanation, I think, why it's harder for you to lose body fat and grow muscle. Do the same things that you've done before with ease, potentially. Now, there's a couple other things that add to that with type 1 diabetes, which is that us type 1s, we are more prone to other autoimmune conditions because we already have the autoimmune condition, which is type 1 diabetes. But especially for women, especially throughout menopause, this has the tendency, because today we're talking about losing body fat in that period of life, this has the tendency to lead to also more autoimmune thyroid conditions, Hashimoto's, okay? And we know actually that more than 70-80% of thyroid conditions are actually autoimmune related, which means that if you already have this autoimmunity issue, then your immune system attacking your thyroid will make it even harder to lose body fat and grow muscle, and then also, right, have a decrease in energy. Okay, so it's something that just becomes more common in your 40s, especially for women. And then in this window, you're getting like a thyroid condition, like even have a bit of a sluggish thyroid. Maybe also it's not diagnosed properly because I don't know, the lab ranges. The results are not how do you call it, significant enough to get like a diagnosis, but your thyroid still is kind of affected. It affects your metabolic rate, and you end up in this place where you're just doing more dieting and nothing's really working anymore. And that's like because of this whole stress loop, then the hormonal situation playing into that, and then also the thyroid being attacked, and stress of course also increases the autoimmunity again. So I think you get a good idea of like the interplay of these different things. Just want to also mention the thyroid because it also plays a role. A lot of my type 1 clients also have thyroid conditions at the same time. Doesn't make it impossible. We're talking about in a second how you can go about everything, but that's important to understand, as in where you're coming from. Now, where most women get stuck is it's your hormone statement that they get from their endo, who tells them that because of your metabolism, because of your hormones, because of whatever, you can't lose body fat. That's not true, right? And a lot of women left like feeling powerless because even the doctor tells them it's not going to be possible, or they have done everything themselves. But that's not true, and that's also not what the research shows. So, right, talking about like official statements, that's also not what the research shows. The research shows hormonal shifts make it harder, just like I explained. But if anything, the levers that we're talking about in a second now matter even more, are even more important than they were in your 20s and mid and early 30s. Now, let's talk about what to actually do. Number one, because it's the big one, strength training. You've probably heard it tons of times, but are you still doing it? Are you still doing it consistently? Are you doing it in a way where you're tracking progress and actually getting stronger and you get where I'm going, right? And actually seeing visible difference in the mirror, and also, right, just feeling more toned, feeling stronger. That's really important, because it comes back, it comes down to, like, one of the aspects is the glucose sink phenomenon that I just mentioned, which is your muscles, after they've worked, literally pulling sugar out of your blood. And as you're getting stronger and the glycogen storages in your muscles are getting bigger, your body gets the ability to pull even more sugar out of your blood. So it's not just about doing strength training here and there and kind of doing it. It's actually about getting stronger and progressing and going somewhere, because it's a never-ending journey. It's not something that you should just do once and then stop again. It's something that you consistently do, because this is what allows your body to, or allows your muscles to pull the sugar out of the blood, and therefore overall just need less insulin to do the same job, okay? Now, there is studies that report a meaningful increase in insulin sensitivity, like a significant increase, and losing belly fat in as little as 30-minute sessions. And that's also around about what I'm doing with most clients, like 30, 40, sometimes 45-minute strength training sessions 3 times a week. And this is the lever that now relatively works even better than in your 20s and 30s, as I said, because now the effect will be even bigger, since you're already in a place where you tend to lose muscle and your insulin sensitivity tends to drop. Now, if you're doing that now, you're implementing something that actually makes sense, then the difference will be huge compared to the version of you that doesn't do it, or compared to your type 1 friend who doesn't do it, you see. The next thing is protein, which, right, has a lot to do with the first one as well. If you eat more protein, or enough protein, sufficient protein, then this protects your muscle mass. You tend to not lose that same muscle mass, and it's an absolute non-negotiable, okay? Amongst others, also eating more protein relatively to your overall caloric intake will also, of course, help keep blood sugar stable, because if more of your calories come through proteins, then you will have like a more stable blood sugar throughout the day. That's also pretty straightforward, I would assume. Then walking after meals is a big one as well. Now, of course, it's important to mention that it's difficult to implement some of these changes, because especially if sleep is disrupted, if stress management is worse, and if you have more cravings, it's potentially even harder to implement these things. But still, right, let's talk about them so you know what's the ideal scenario. Walking after your meals, or generally walking throughout the day, doesn't always need to be your generic 10,000 steps. That's really not what's important, but continuously walking 7,000, 8,000 steps, also a good number. But then especially after your meals, around your meals, that's what helps needing less insulin for the same amount of carbs, for the same amount of food than you would usually eat. The next one, number 4, and I would even, if I look at it, I would even place it as number 2, because it's just as important as the strength training part, is your sleep, okay? Protect your sleep like it's your salary. It's absolutely crucial. 8 hours, go to bed before 11 p.m., ideally, in an ideal world, 10 p.m., wind down the last 2 hours before bed so that your nervous system can wind down, so you give your body the rest it needs. Don't do emails until 11 p.m. and then go to bed, or don't watch a horror movie at night, or like some action Netflix series, right? Allow your body to wind down. Watch an animal documentary as opposed to reading like a horror thriller or something like that. So these things are just absolutely crucial. Also, if you avoid screens after 8 p.m., this will help a lot when it comes to winding down, just avoiding laptops, phones, especially. The TV is a bit of a different thing that actually tends to work a bit better, because the TV is more distant to your eyes, like the screen is more distant to your eyes, which tends to help with, right, not affecting sleep that much. Managing stress, and consciously don't say reduce your stress, because as I described, for most women in their 40s, they have more responsibility at work, they have children at home, so that stress factor, it's there for a reason, right? Your body is supposed to be alert and quote unquote stressed to an extent to make sure that you can keep up with things. But when it comes to managing stress, what you can really do is essentially the things that I said before. Take your micronutrients, vitamins, Make sure that you're doing the strength training, that you're sleeping, you're prioritizing that, you're eating throughout the day, you're eating enough protein, and the last 4 hours before bed, ideally you would want to stop. So implementing these things in your day-to-day, absolutely crucial, so that your body can manage that stress well. And the last thing is the carbs, which I mentioned specifically because most women that I've worked with have done some form of no carb, low carb, keto, whatever. And also with type 1 diabetes specifically, we already have so much stress with the blood sugar fluctuations and mental load of managing type 1. Already so much inflammation. We don't need extra stress with the diet and with what we're doing there. So eat carbs, have tinier portions of carbs that you can inject insulin for easily instead of having like these big portions of pasta for lunch. Tiny portions throughout the day, have some snacks as well, eat fruits, these kind of things. And then at night, have your carbs, right? Also rice, pasta, these kind of things are allowed, but have them 4 hours before bed, right? So you can inject insulin, your blood sugar can flatten again, and if there's something off with what you calculated, which tends to happen sometimes, then you're correcting it, but then you can go to sleep without having to worry because you had like a pizza right before sleep or something like that, right? So keep 4 hours after dinner until you sleep. So that would be some basic things on how to manage carbs throughout the day. All right. So these are all absolutely crucial parts when it comes to managing blood sugar with menopause and making sure that you keep on losing body fat and keep your muscle, or ideally grow your muscle, and feeling confident in your skin, feeling good in your skin. Of course, also there are some medical roads to go. So if you feel like completely off and nothing of the things that I mentioned really help you feel better and get back your energy, then of course you should talk with your endo, with your doctor, and then, right, they will tell you if HRT, hormone replacement therapy, would make sense. You can also get your thyroid checked, of course, if it's like severely off with hypo or hyperthyroidism, then this medical options can make sense as well. That's something, of course, you need to check up with your endo and or doctor on, right? But to give you one client example of how we implement, well, I just walked you through. I can give you a client example of my client whose name is Geraldine. She's 48, she has a high pressure job, meaning she worked 50 plus hours as a designer, like a stressful corporate world. Obviously was also in menopause, had sciatica, back pain, sleep issues, the full story, everything I just walked you through. And what we did with her, because she had been on diets before, we kept it simple rules of thumbs on how to approach food and keep blood sugar steady throughout the day, implemented strength training, implemented intervals, and without counting calories, but by just making sure that these basics work. She improved her quality of sleep, tremendously increased her energy, felt at her best, and said that she was never as fit as when she worked with me, not even in her 20s, okay, by implementing these things in spite of the busy life, in spite of her children studying in the United States and like just having a lot on her plate. And as you can imagine, it's not easy to implement these things, but keeping it simple, making it pragmatic did the trick for her. And if you feel like, okay, you kind of know what to do also after listening to this episode, but it's been hard for you to implement everything, then feel free to drop me a note on Instagram, right? Just send me the word reset so I can check if what I'm doing with my clients could work for you, how this would look for you specifically, if I can help, how this would look like, and what you would need to implement in your day-to-day to check if I can help. Otherwise, remember, if any of this helped, if you found this at least a bit interesting, to scroll up, subscribe to the podcast on Spotify and or YouTube, whether you're listening. Give this podcast a rating as well, and I'm looking forward to the next one.